But let's get down to business now. We got this young man. We're so excited. I first met him backstage April 23rd at the event we had in Dallas, Texas. Down. He was one of the reasons I went down. We spent 10 minutes together backstage talking and sharing the power of impact and what it's going to do for all of us IBOs out here in the field working our business. He was with us Monday. I love Mondays. Monday, June the 27th, he was with us. Matter of fact, he's starting what a great way to start this month off. Learn the value of the impact system. So today we have with us Impact's Healthcare Share co-founder. And I'll tell you, he was an amazing young man. Love to talk with him. And guys, get your notepads out and pens. If Gary take notes, when he's got his staff on with him as well, one of his doctors. Without further ado, can we give a warm welcome to the great Mr. Phil Chrysler from Impact Health.
What is healthcare sharing? I'll tell you what it is and what it is not. Healthcare sharing is a concept that has been around since the early 80s, but has grown significantly in recent years. Reason is that for many families, individuals, and small businesses, healthcare sharing has become an alternative to the high cost of health insurance. As a result, hundreds of thousands of families across the country come together through the magic of technology to share the burden and pay each other's medical bills. Now, to what it's not, it is not insurance. In fact, as opposed to insurance, healthcare sharing is a nonprofit approach that enables families to access affordable healthcare. And for most families, healthcare sharing can save them over $9,000 a year compared to average insurance plans.
All right. Wow. Mr. Thomas, it is so good to see you again, my friend, and good to begin August with you today.
Absolutely.
Yeah, thank you so much. I appreciate the time and just the invitation to be on your team. And what a great promotion ACN has thrown out there for August. So many ways, right? For the IBOs in your organization, every organization to earn money this summer. So how special. We're just proud to be one of the service providers to come alongside these other great service providers where you have a choice, right? An a la carte menu, if you will, on what services do you want to wrap your mind around and promote and talk to others so you can gain customers, and then ACN pays you along the way. So how generous of them to do that. But thank you. Thank you for being, generous with your time and allowing me to be on here. I'm going to talk for a few moments, and then I want to introduce Dr. Maharaj, who's our medical director, along with our vice president of billing. And we just, for our young organization, we just passed the processing over 25,000 bills in just over 2.5 years. And she leads the efforts on that. And her team are doing really, really good work. Not only have they processed that kind of volume, but they're sending payments to the provider in 19 days, right? 19 days. So that's one of the beauties that you'll hear about us, our not-for-profit approach, our member-centric approach, really being able to focus on our members so we can make you seen as a good customer to your doctor and those providers that you see. But healthcare sharing, let's unpack that real quick. Healthcare sharing is something that's been around for decades and decades. It really started out of the church, right? When your friend needed help with some medical bill that they couldn't afford. It was literally pass the hat around the church. Everyone puts in some money, and then they delivered the money to the family in need. And that's how it began. That's really the heart of healthcare sharing. And it got a lot more sophisticated in the last decades, and certainly with the passage of the Affordable Care Act in 2012, I believe it was, we actually had some carve out language that exempted you from the individual mandate, that penalty that is no longer in place, but was at the time, if you were a member of a healthcare sharing organization. So they've grown in stature, right? In that regard. Basically, it's a risk reward concept. The risk is I cannot, as an entity, nor can any healthcare sharing entity, say we can guarantee all your eligible medical expenses will be paid. We can't do that because the entity of Impact is not paying those eligible medical expenses. it's the members of Impact, and they do it on a voluntary basis, which is great, right? You're not into an annual contract or stuck in that regard. It's really a subscription for your healthcare, and so that's the risk. The reward, you get to pay 30, 50, sometimes 70% less per month for comprehensive medical program, right? And so that's the risk versus reward concept, and no wonder it's on the rise in that regard. But it is based on those eligible medical expenses that is getting paid based on the monthly contribution of its members. So you just got to flip the switch in that regard. And I would submit to you for consideration that the so-called guarantee that you get with traditional health insurance companies, there's a lot of gotchas, right? Did you go in the network? Did you go out of the network? Oh, well, you might have to pay 100% or a large percentage thereof, depending on all that. And so it's broken. It needs to be fixed, and it needs to be decentralized in that regard. And that's why healthcare sharing, and specifically Impact, comes along and can help save the day, drive down these costs for individuals, for families, and for small businesses in that regard. You see, we don't have profit as a motivating factor in a not-for-profit healthcare sharing organization. We need to be member-centric, and that means we can price our monthly, what we call your monthly share amount, versus monthly premiums, as the term in healthcare, much lower, right? There are no shareholders to account for. There are no big $1 million bonuses or salaries. Everyone in our organization is paid fair market value, and we have to justify it to a third-party independent auditor every year. So that's one of the things that we do is we sign up independently to an auditor and say, take a look at us, just to make sure we're operating in a good manner, which we do. So we're proud of that. But again, there's no conflict, right, between the not-for-profit and the profit, between its members, providers. That's why we pay the providers as quickly as we do. There's no shareholders, right? We did something last year that was, I was told, had never been done, certainly in health insurance, but also never had been done in healthcare sharing. And that is for our members that contribute on that voluntary monthly basis, our reserve amount, our distributed reserves, which is what pays the medical bills, we're in such good fiscal shape. I said, we don't need to keep taking their money. Let's give them a break, especially in November and December. Of course, we need to pay the people, right? And so we need to still collect the administration costs, and we still need to collect the program fees that pay the vendors. But the monthly share amount, which is sometimes, or the monthly allocation of the medical bill amount, which is sometimes the majority of your monthly share, we didn't need to collect that. So in the month of November and December, our members got to keep $625,000 in their own accounts instead of depositing it to us, right? I think that's great, right? And that just shows you an example of how we can be member-centric, running a not-for-profit healthcare sharing organization in a very fiscally mindful manner in that regard. Here's the deal. The Department of Health and Human Services says about 5% of the population drives about 50% of the medical spend that occurs today. What does that mean? The vast majority of Americans are really overpaying for a service that they rarely use. And so we need ACN to go out and say, friends, there is a better way. You're not using this by the Department of Health and Human Services own statistics. So let's deliver value to them and then help yourself along the way. And maybe they'll just become an IBO and see it like you see it, right? We call that compassionate capitalism. It's alive and well with ACN and Impact today, and it can be with you and your team as you're building people to help save the day for them, drive down those costs for healthcare. It's the number one reason families families, have to file for bankruptcy, unfortunately. So you can, again, help save the day in that regard. So what makes us unique and different in our industry? First, let me say this. There are very good religious-based healthcare sharing organization. I think they're great brother and sister organization that serve their membership well in that regard. We are different. We are an ethics-based healthcare sharing organization. Okay, we are rooted in the love thy neighbor approach, faith ethic, which allows us just to be more inclusive. We can welcome all races, all religions, all colors, all creeds that see it the way we see it and want to help our fellow members share in those eligible medical expenses. And the guidelines are what tells you as a member and potential member what is an eligible medical expense. So you get, complete transparency with us. So again, some of these religious-based healthcare sharing organizations, you have to be of that particular denomination. And in some cases, you have to have your pastor or whatever faith that organization is. In some cases, you might have to have a signed affidavit before they allow you into the community. So we think our approach will serve many, many, many more people than what is being served today with these, again, very good religious-based healthcare sharing organization. Another unique thing about us is the technology platform we use. So we met friends that used to run the largest healthcare sharing organization that's still in existence today. It's religious-based. Two of them were former president and CEOs, and the rest of their team had about 100 combined years of healthcare sharing experience at scale, where they took an organization from about 13,000 members, households, to 130,000 households in just a few year period of time, right? So after their tenure was done there, and what they learned was real pure ways to practice healthcare sharing, great ways that provide transparency, that are best in class, best practice from a regulator standpoint. So they built this technology platform, and then Impact was the very first organization to deploy it in January 2020 when we launched. And so not only we're proud to be member-centric, but we're also proud to lead the industry with the best technology platform out there. As of 2 weeks ago, it just received its full patent, so we're excited about that. But beyond that, right, it just practices pure peer-to-peer healthcare sharing. And for the first time in healthcare sharing, you get to see how 100% of all the monies are moving in an organization. Never has this level of transparency ever been accomplished, certainly in health insurance, but also in healthcare sharing. So we're proud to do that. Also, what makes us kind of unique is, there's no network, so you can see any doctor you want. You own your own member account. You give us permission to pull the admin, pull the program, but those monies that you deposit in there on a monthly basis for your share amount, that's your money. You own that account, okay? So one day you may leave membership, right? And typically there may be some money left over in that account. After the 60th day, you're able to, whatever money's in there, you're able to request it, and we'll send you the balance. So I've sent as little as $100, and I've sent a couple $1,000 back to members that have left membership for whatever reason. Typically, it's their employer is providing healthcare or a large portion thereof, and so, but that's what we're embracing. That's what we're doing. The pureness of healthcare sharing and honoring that effect that it's your money paying for the eligible medical bills, and it's your money in your account. Whatever's left there, you're able to take. And so that's not being done anywhere else in healthcare sharing either. So I know Dr. Maharaj in a few moments is going to talk about, the comprehensive program that we have, right, in that regard. And so, there's, from your perspective, there's really, who are we looking for? we see it, the opportunity is this: between the non-group people, the individual market, right, and between the underinsured and those that aren't insured at all, it's about 90 million people and growing, friends, and growing. Again, Kaiser Health Network just published a study that they partnered with NPR on about a month ago. And it's over 100 million people in America today have some form of medical debt. A lot of it's being hidden by the fact that it's on their own personal credit cards. Credit card debt, the number one category for credit card debt is medical, right? And so, yes, the need is there. It's alive, and unfortunately, and unfortunately continues to grow. And so you can partner with us, with ACN, and again, help save the day, deliver some true value to these families, individuals, and small businesses that absolutely need it. 80% of the US adults rate lowering their healthcare costs as their number one priority. And that is only going to increase because in this economic cycle that we're in, I know there's debate on both sides whether we're going to have a recession or not. We're certainly in an inflationary environment. Both sides of the economists agree on that one. The only debate, and the percentage continues to grow up, is how bad the recession will be when it happens. None of us know that, but I know this: healthcare sharing grows even more than normal in these type of downturn events. Why? Because more people are looking to cut costs. They're looking for alternative ways, right? They're open to alternative ways. And so you can rely on a for-profit health insurance company that is looking out for its shareholders, or you can bet on your fellow community members that are like-minded and that practice in a very transparent way, in a non-for-profit way, a community that will support you in your hour of need. So the choice is yours, right? And it couldn't even be more clear and more obvious than what it is today. So the good news is the other side of this cycle, right, is in small businesses are trying to keep employees, right? The quit rate is at an all-time high. People are doing what you're doing, having multiple gigs to support their family. So they're looking for ways to keep good employees, but they can't afford health insurance. So again, we can help them in that regard. Our group program, which will be launching soon with ACN, will be able to support up to 49 employees. And again, here's the cool thing. If they decide to leave employment, whether it's the employer or their own choice, they get to take their Impact membership with them. It's portable. So they're no longer tied to their job for their healthcare. So very, very cool. Here's what's happened over the last decade with our very good brother and sister religious-based organization who aren't as inclusive, right? The industry has grown over 1,000%, okay? 1,000% in the last decade. Imagine with Impact, with ACN, right? There's no better customer acquisition entity in the direct selling industry than ACN. Imagine with the need to keep employees, with the quit rate being high, with people being more open to doing what you're doing, and that's working multiple gigs, with bankruptcy already what it is with healthcare. Most people are looking for alternatives, right, in that regard, and entering in an inflationary period, perhaps entering a recession. The opportunity has never been greater. You got every single trend on your side. That's never happened in healthcare. Every single trend right now is on your side. You just got to go out and help it. And we partnered with ACN for this phase one, where you send us leads, our team calls, you're informed through your personal customer list on the activity, on what's going on. And there's going to be some more ways people can join here in the coming weeks to make it even more friendlier, to get more people through the system faster. So with that, I know I've been talking a lot, but I would love for Dr. Maharaj, who's our highly capable medical director and leads just a terrific team for vice president of billing, to come on, talk about our comprehensive program and some of the things that she sees why Impact is the best positioned healthcare sharing entity in the United States today. Dr. M.
Hello, everyone. Happy to be on the call with you all. As Phil mentioned, we at Impact Health Sharing definitely offer a very comprehensive plan, something that we're very proud of. So I just wanted to highlight some of those features and what's included in what we call our comprehensive plan. So for starters, we do share into wellness. So getting your annual physical, seeing your doctor once a year, that is something that we do share into. And when I say share into, that visit is going to be completely free to you as a member, no out-of-pocket costs. It's something that regardless of if you've met your PRA, which again is what we call your deductible, that's going to be completely free of charge to you. You can literally sign up for August 1st start date, go get your annual physical on the 2nd, and it'll be completely free. In addition to that, we understand that when you see your provider, generally there's some lab tests that go along with that. They usually want you to get your cholesterol checked, get a complete blood count, make sure your blood work is all well and in check. So in addition to the free visit, you get $150 credit to use towards some of those lab tests that your provider generally orders. So it's a great thing, something that we took feedback from our membership and added that for everyone. In addition to that, something that I believe that we share into that most insurance companies don't always share into, and if they pay it, it's not at the same level that we do. And a lot of other healthcare sharing companies surely don't share into it at the level that we do, if at all. And that's for outpatient therapy. So every membership year, every single member gets 50 visits that they can use towards any combination of the following. They can use it towards chiropractic care, physical therapy, occupational therapy, speech therapy, respiratory therapy, and cardiac rehab. So, and again, that's per member per membership year. So let's say I have a family of 4, I can go have 50 visits. I can see my chiropractor if I need to. I have 50 visits. Let's say I have a child that requires speech therapy. Maybe their speech is a little delayed and they need to have that therapy done. They'll get an additional 50 visits. So it's something that is a great thing to have that, again, a lot of insurance companies are not paying into that at all. And if it's very limited. We also share into home health, something that, again, a lot of traditional insurance companies don't pay into, and other healthcare sharing companies are not offering either. And we allow up to 40 visits per member per membership year. So let's say you end up in the hospital, unfortunately, you have a stroke or a heart attack, and you need a little bit of extra help when you get home. You can have that up to 40 visits included in your membership. Now, we also, one of my favorites is free telehealth. So we do share into and offer telehealth, but it's completely free of charge. That means it's zero out-of-pocket cost at any time, as many visits as you may need, you can use that. That's something that I find myself using quite a bit. It's great if, you know, it's a weekend or it's the middle of the night, you have a young child, or even you yourself may not be feeling well, and it's not something that you necessarily need to run out to the emergency room or urgent care for, but it's something that you want to address. You don't want to wait on it. You can jump onto your member portal, sign on, you'll see the provider via video. You can explain to them what's happening. They can ask you questions. And if you need a prescription, they can send that to your pharmacy, all done virtually and all completely free of charge. It's a great thing for those of you that work and maybe your job's not as flexible and you can't take time off in the middle of the day. You got a little cough or cold or upper respiratory thing that you need addressed. It's great for that. Great for little kids. Middle of the night, I have a daughter with an earache. You don't want to rush off. Tylenol is not doing the trick. You know, you can jump onto the telehealth visit and get the care that you need. So something that I definitely love, and I think it's a great thing that we share into. In addition to that, mental health. A lot of insurance companies, they're now starting to share a little bit or pay a little bit more into mental health, but overall, it's not something that all of them do, and definitely not something that all healthcare sharing companies share into. But we do offer virtual mental health. So again, jumping on to your member portal and seeing your therapist, psychologist virtually, getting whatever you need addressed. And again, any prescriptions can be sent accordingly if needed. And we also share into outpatient mental health. So you may need to go see a counselor, you want to go have some counseling or what have you, we have that in our program as well, which is great. And then my second most favorite thing, probably tied for my first, because I really do love it, is our prescription savings plan. We offer wholesale pricing for medications, and I've seen it time and time again where I use it myself. And when I compare it to what I was paying when I was previously on traditional insurance for the exact same medication, we're beating that pricing by $10, $15 every single time. And that's compared to someone that has a copay with a traditional insurance company. And when I compare that same exact medication to what I'm paying through our prescription savings plan, it's $10 to $15 cheaper. So it's a great program that we do have. And then lastly, maternity. We share into maternity up to $150,000 per mother. And previously we had included the medical bills of the baby with that $150,000, but we have since excluded the baby. And so they no longer have that limit with the mom. And the reason why I bring that up is because at Impact, we're constantly taking feedback from our members. We're constantly trying to improve and offer more. As Phil mentioned, we're a not-for-profit organization, so we're not driven by any sort of financial gain. We all get paid what we get paid, and it's a fair market pricing. So whatever money is there belongs to our members. It's not our money. As Phil mentioned, when the reserves are great and they're healthy, and he is able to waive shares monthly, that's something that we do, again, because just because there's extra money there doesn't mean that we get to keep it or we have stakeholders that get to share that profit. So we're constantly taking feedback, we're constantly improving and looking for ways to offer more. So all in all, we have a great comprehensive program, great for a lot of people. And so we are very excited to move forward with ACN, and happy to be on the call with all of you today. Thank you.
All right. Thank you so much, Dr. M. She makes Impact better in so many ways. She's built such a great team and serves all of you well in that regard with processing those medical bills, paying those providers in 19 days later, right? Just so you can be seen as a good customer. And it lifts up the reputation of healthcare sharing too. So we feel like we're being a good steward on many fronts in that regard. So Mr. Thomas, I just, again, thank you so much for for the opportunity really to come and speak to a lot of your team members about the really uniqueness of this ACN Impact offering and how in America today it's more needed than ever. I really believe we are the Airbnb, Uber, Lyft of healthcare in the infancy stage, and all of you are going to reap the benefit financially of being a shareholder, if you will, a stakeholder for certain in that regard. So, Mr. Thomas, thank you so much, my friend.